Good evening, friends. Welcome back to the channel. Today is Monday, June 22nd, 2026, and we are diving into a massive day for medicine. From historic global cancer breakthroughs and game-changing FDA approvals to the absolute chaos surrounding medical entrance exams in India, we have a lot to unpack. If you want to stay ahead on health tech, new cures, and global medical updates, hit that subscribe button right now. Let's get into today's top stories. Segment 1, the global breakthroughs. Pancreatic cancer survival rates double. The big news, landmark clinical trial data published in the New England Journal of Medicine shows a major victory against pancreatic cancer. The drug, a new targeted therapy drug called daraxonrasib. The impact, for decades, pancreatic cancer has been notoriously hard to treat. This new drug targets the specific KRAS mutation that drives the tumor. In Phase 3 trials, it nearly doubled overall survival rates for patients compared to standard chemotherapy, extending survival from 6.7 months to 13.2 months. This is a massive 60% reduction in the risk of death for these patients. Stanford regrows knee cartilage. The science researchers at Stanford Medicine have officially found a way to regenerate worn-out joint cartilage. How it works, by blocking a specific aging-related protein called 15-PGDH, scientists successfully restored lost knee cartilage in older mice and even grew new, functional tissue from human samples. The takeaway, this means in the near future, instead of getting painful, invasive total knee replacements, patients might just get a simple local injection to regrow their joints. Segment 2, FDA watch and new approvals. Pediatric type 1 diabetes milestone. The drug, sealed teplizumab. The update, the FDA has granted accelerated approval for new use of this drug to delay the decline in insulin production in children aged 8 to 17 who were recently diagnosed with stage 3 type 1 diabetes. It is the first treatment of its kind to help alter the actual course of the disease in kids. Flu season gets cheaper and easier. The drug, first generic version of Xofluza, baloxavir marboxil. The update, the FDA just approved the very first single-dose generic treatment for influenza and flu prevention. Approved just in time for the upcoming flu season, this will make the popular single-dose pill significantly cheaper and more accessible for families. Kidney and heart protection extended. The drug, finerenone. The update, a trio of major medical studies concluded that this popular kidney drug can actually protect the heart and kidneys of millions more people than previously thought, drastically slowing down the progression of chronic kidney disease. Segment 3, medical education crisis in India. Now, let's pivot to India, where the medical education system is dealing with unprecedented logistical drama. The historic NETUG 2026 re-exam. What happened yesterday, on June 21st, more than 20 lakh, 2 million, aspiring doctors had to sit for the incredibly tough NETUG entrance exam for a second time. The cause, the original exam, taken back on May 3rd, had to be completely scrapped by the National Testing Agency, NTA, following widespread outrage over question paper leaks on platforms like Telegram. Airport-style security, to ensure no leaks happened this time, students were met with biometric scans, metal detectors, and heavy police guard. The NTA today officially dismissed a viral video claiming a second leak, confirming the re-exam was completed successfully and securely. The verdict, student feedback from the paper analysis shows that while biology was fair, the physics and chemistry sections were time-consuming and moderately difficult. NETPG postponed last minute. The fallout, in a related shockwave, the Union Health Ministry abruptly postponed the NETPG entrance exam just hours before it was supposed to take place. The government states this is a precautionary measure so they can audit the safety of the testing process and prevent another leak. Segment 4, Fast in Tech and Trends. AI healthcare boom. The big deal. Today, AI drug giant in silico medicine announced a staggering $2.5 billion partnership with SK Biopharmaceuticals. The goal, they are using generative AI to skip years of lab testing and directly pinpoint drug candidates for complex brain and neuroimmune disorders. Weight loss drugs curbing violence? The Weird Science, a brand new study out of Rutgers University suggests that GLP-1 weight loss medications, like Ozempic and Wegovy, are linked to a surprising drop in violent and impulsive behavior. Scientists believe the medication directly calms the impulsivity centers of the brain. DPT/MMR. Asterisk in 1974, a paper published in Archives described a series of children who suffered serious acute and, usually long-term, neurological events after inoculation with the combined diphtheria/tetanus/pertussis vaccine. Despite this being a case series, with no controls, the authors posited a causal connection and blamed the whole cell pertussis component. This message was taken up by the UK media and raised in Parliament. Almost overnight, the uptake of the combined vaccine fell and notifications of pertussis rose. It took 15 years for uptake of the vaccine to recover. 24 years following publication of the Archives paper, a smaller case series was published in The Lancet, claiming a link between bowel problems and autism. A temporal association with the MMR vaccine was noted, and the lead author called for a ban on the combined vaccine. This resulted in a fall in MMR vaccine uptake. There is now a significant body of evidence in favor of no causal link, but many parents remain hesitant about vaccinating their children. abc.bmj.com. Competitive gender gap. In general, studies show that women don't like competition as much as men. It's not that women are afraid of losing the theory, it's that men are a bit overconfident. That difference may be a good thing, though. A study of 42 countries found that societies are less happy when both genders are highly competitive. WebMD. Ibuprofen and acetaminophen and coffee. Caffeine can actually make common pain relievers like ibuprofen, paracetamol, or acetaminophen work better. One review found that people who took an over-the-counter painkiller along with 100 milligrams of caffeine, roughly what's in a strong cup of coffee, got roughly 10% more pain relief. Researchers aren't exactly sure why this happens, but they think caffeine may help your body absorb medication and keep it in your system longer. Ibuprofen isn't sold with caffeine added, but you can try taking a 200 milligram dose alongside your morning coffee. WebMD. The Future of Lung Health, June 2026. The Death of the Rescue Inhaler. If you or a loved one relies on a standard Blue Rescue inhaler for asthma, pay close attention. As of June 2026, medical experts say relying on these quick-fix inhalers alone is dangerous. The big news, the newly released 2026 Genius Strategy Report officially marks a major shift in primary care. Doctors are now told to transition patients away from standalone bronchodilators. The problem, old rescue inhalers stop the symptoms for a moment, but they do nothing for the underlying swelling in your airways. The new standard, everyone over the age of 12 with mild asthma should now use an anti-inflammatory reliever. This means using a combination inhaler that pairs a fast-acting medicine with a low-dose steroid every single time you feel a flare-up. Reframing COPD therapy. The GOLD 2026 COPD guidelines completely change how we look at chronic lung disease. Instead of waiting for a patient to get worse, doctors are tracking disease activity in real time. New GOLD 2026 strategy focuses on stopping disease activity early, uses advanced biological and triple therapies, lowers thresholds to catch flares early. The power of biologics. For the first time, advanced biologic medicines like dupilumab and mepolizumab are recommended for heavy COPD flare-ups. If a patient has a high white blood cell count, eosinophils, and keeps getting sick, these targeted shots can quiet down the immune system to stop severe attacks before they start. Microscope Segment 2, Breakthroughs from the ATS 2026 Conference. The American Thoracic Society, ATS 2026 Conference wrapped up its sessions with massive drug pipeline news. An oral pill for sleep apnea. Millions of people struggle to sleep with bulky CPAP masks. Data from the Synergy trial revealed a brand new experimental pill called AD109. It is a neuromuscular pill that keeps the airway open at night without needing a mask. Hope for lung fibrosis. Treating idiopathic pulmonary fibrosis, IPF, is famously difficult. New data from the Teton trial showed that an inhaled version of treprostinil successfully slows down lung function loss and keeps scar tissue from spreading. Treating smokers successfully. A trial using the drug tezepelumab proved that advanced biologics still work perfectly in patients who smoke or have overlapping COPD. This gives doctors a powerful tool for high-risk, real-world patients. Robot face AI and high-tech lung imaging. Technology is taking over the pulmonologist's office. The biggest buzz this month is around functional respiratory imaging, FRI. Instead of looking at a flat, blurry X-ray, new AI tools create an exact 3D structural model of a patient's lungs. Doctors can now see exactly where air is blocked and watch how a drug changes the airways within just days of starting a new treatment. This eliminates weeks of guesswork for severe asthma and lung disease patients. Stop sign actionable takeaways for their next doctor visit. Medical updates mean nothing if they do not change your daily life. If you want better lung health today, take these 3 steps during your next medical checkup. Ask about your phenotypes. Ask your doctor if your asthma or COPD is driven by type 2 inflammation. A simple blood test can tell you if you qualify for life-changing biologics. Review your reliever. If you are still using a basic albuterol inhaler, ask your doctor if an anti-inflammatory reliever is right for you. Look into digital tracking. Ask if your clinic uses remote lung monitoring or advanced imaging tools to catch lung damage early. Outro. That wraps up your daily medical dose for June 22nd, 2026. What do you think about the ability to regrow your knee joints or the massive exam security measures in India? Drop your thoughts in the comments below. Don't forget to like this video, share it with a friend in medicine, and subscribe for your daily health tech updates. Stay healthy, and I'll see you tomorrow. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.